Hi, I'm Luisa,
And Michael,
and we are retired and living in Mexico. And today we're going to answer one of those other burning questions that our viewers and our friends ask us all the time. What do we do about healthcare?
when we speak about healthcare, we're going to talk about specifically what we do. There are multiple options for living here in Mexico, and each one will work for people's specific needs. But let's talk about how we manage our healthcare here.
Right, because we do not, first of all, we have military healthcare for life. We have TRICARE for life, and we also have Medicare.
Yeah.
And which ones do we use here in Mexico?
So here in Mexico, what we do is if we got into a situation where literally our deductibles were over $200, I would file a claim with TRICARE overseas. And if it is a covered benefit, they will pay for 80% of that bill.
Okay, but here in 2024, what is the cost of having TRICARE overseas?
TRICARE overseas, I'm not paying anything day to day for it because of my military retirement.
So is it free?
It's free unless you use it.
Oh, okay. So I've had to go to the doctor a couple times, and so has Michael.
Yeah.
For example, we were just in
Mexico City.
And we ate something not so good, and we had Montezuma's revenge, I like to call it, but we were sick for about 4 days.
Yeah, it was awful.
Yeah, both ends awful. So we went to the pharmacy because Michael, being a retired PA, he was able to say, "Oh, this is what I want."
Yeah.
And most people think you go to the pharmacy in Mexico and they'll just give you over-the-counter kind of stuff, or even prescription-only stuff.
Right.
However, the pharmacy we went to said, you need a
prescription for the antibiotic that I knew that would make us feel much more comfortable and resolve the issue.
So we said,
where's the doctor?
So the pharmacist said, oh, go to the Walmart. They have a consultant
there.
So we go to Walmart, which is another, 500 meters down the road. And for 45 pesos.
How much is that?
Like $2.
$2.
We talked to the doctor, and we each paid 45 pesos. And we just told him, we would like this medicine, please. And he said, okay. And we left the consultant's office, which was right in Walmart next to the pharmacy section. And then we went to the pharmacist and gave the prescription, and she gave us double the amount.
Yeah, I'm not sure why that worked out like that, but
I don't know either, but that cost us 100 pesos each. So that was like $5.
$5.
So this is why we don't worry too much about having insurance, because when you're paying $2.50 to see the doctor and $5 for the medicine, how can you not say why we don't need to use insurance?
And we've had some things like you go to the dermatologist once a year for a full up-to-date professional evaluation.
And I get stuff zapped off of my face all over the place.
And how much did that cost?
That cost me about $75
for
all of that. For the appointment and the zapping. So it's very affordable here. The other thing that I have gone to, I went to the, who was the lady that helped me with my shoulder?
Oh, a
physical therapist.
Physical medicine physician.
Yeah, and I had to go for, that cost me about 200 pesos, $10 a visit.
A visit. Can you imagine?
For an hour of physical therapy. Because I had frozen shoulder, which now is really good. And that was amazingly affordable. Also, I went to the urinologist, what's it called? The urogynecologist lady. And everything is so reasonable here. Plus, you do not have to wait 3 months to get an appointment.
That's just absolutely amazing. You don't have to have a referral from your primary care doctor to see a specialist.
You just go in and call. I just call them.
Hey.
Yeah. So that's how we use healthcare here.
And dental.
Dental.
Let me talk about dental. So it's just, I was thinking about renewing my U.S. dental plan and then going back to the States and seeing them once or twice a year, which means I had to pay for a flight and then make an appointment with the dentist. But what I found here, the dental people here are trained just like U.S. dentists. And so I found one that does an exam, cleaning for literally $50 to $70.
Do they use that?
Yeah, for me, I use a hyfricator, I think it's called.
Cavatron,
excuse me. And they do a wonderful job. And then this year had something that has never happened. I chipped a tooth. And I was thinking, oh my goodness, what's going to happen? I'm going to go into a dentist. They'll look at me and no telling what'll come out. But I went in and found a dentist who did cosmetic dentistry. She spent an hour. My tooth is perfect. I paid no more than $200 to have my tooth repaired, and it's been magnificent. And I'll go back to see that dentist in the future.
However, I, on the other hand, do not like having that Cavatron. And so what I do is every 6 months that we go back to the States, because Michael goes to the VA still for his hearing aids and some eye checkups. I go to my dentist that I have been going to for the last 30 years in San Diego. And I don't have dental insurance. So that one cost me about $250.
Yeah, we could pay, but when we did the crunch the numbers, it just made sense just to pay out of pocket.
Yeah. And they have known me forever. They don't use the Cavatron. They know that if they hit a nerve and I hit the roof, I'll be out of there. So they're very kind to me, very gentle. And I just call them up and say, hey, we're going to be back there in October. Do you have a spot? They fit me in. No problem. I use my credit card and bye. So we have good support. We have good teeth. We have good health. So we don't really have, we don't have any ongoing medical issues.
So the only thing that I worry about, and this is how we'll deal with it if it happens, what happens when that emergency? What happens to trauma? What happens if you get hit by a car?
No.
So here in Mexico, generally speaking, they may want to have some money up front until your insurance kicks in. And what I'm talking about is anywhere from $12,000 to $20,000.
Yeah, at the hospital before they'll treat you.
So, we're prepared to pay that in addition to getting on the phone and talking to the people at TRICARE overseas to file a claim. So that's how we'll handle that.
And one other thing that we're going to figure out this year before we get going too much further is we have an appointment with a lady here in Puerto Vallarta who's very knowledgeable. She holds seminars every year for expats. Those are people like us who don't live in the U.S. anymore, that will tell us what to do for end-of-life issues. For example, if one of us gets hit by a car and dies and the other one has to figure out what to do, we don't know at this point, except for we know we're not going to have our bodies shipped back to the U.S. because where would we go? But we know there's some paperwork that we have to deal with. If unfortunately both of us were to go at the same time, we don't want our kids to have to then go, whoa, go back and get the parents. Where are they? In fact, when we were in Mexico City, I went to renew my passport at the American Embassy, which we'll do another video about that because that was really very simple, but a little bit stressful until I figured it all out. But while I was in the embassy, this poor lady came in who was probably younger than me, but not a lot. She came in just in tears, speaking only English. She didn't speak Spanish. And she was trying to ask somebody in the embassy, what do I do? I just got notified that my mom passed away while she's living here. She didn't know what to do. And guess what? The embassy said, we can't help you. They had no way of helping her. So we have met some people when we were in Chapala.
Yeah.
And one of the guys that we spoke Spanish with, who was at the intercambio, he was a guy who ran a funeral home.
Yeah, he helps people who have died in country and help them manage to
the families
move the bodies or do whatever they want to do with it.
Okay, so I had a friend who
her friend's son.
her friend's son who was down in Oaxaca at the beach, and he was like 42, and he drowned in the ocean. I think he had a heart attack, but his wife and family were all back in the States.
Right.
And so was my friend who called me and said, can you help us talk to the funeral director, because it's all in Spanish, so we don't know what to do. So it turns out there was a whole list of things they had to do to get his body sent home to the US. And, you need your passport, you need a birth certificate, you need a marriage license, all this stuff that we're going to make sure we all get taken care of, so that if something happens to us while we're living here in Mexico, that our kids won't be going, well, we don't know what to do. So we're going to go to that seminar, and after we go to that, we'll do another video to show you what we learned on that, because that's kind of important, those end of life decisions.
Sure.
Yeah. So in the meantime, healthcare, we don't worry about it so much, because we do have a credit card that if we have to pay a whole bunch of money up front, we could do that.
Yeah.
We also have TRICARE for life and TRICARE overseas to help reimburse if something like that were to happen.
Yeah.
But in the meantime, we pay out of pocket.
Yep.
And
very affordable here in Mexico.
A lot of people do that. And a lot of people come down to Mexico for teeth,
dental,
implants,
right across the border.
Or even all the way down here.
All the way down here, yeah.
Yeah. So dental, what do they call it? Dental tourism is
Dental
huge,
tourism.
because people need to have teeth replanted or implanted or something.
Yeah.
So those kind of things are very affordable in Mexico. And yes, the healthcare system here for expats is amazing.
Especially the drugs.
The drugs?
Yeah. So for instance, you may pay $300 for a prescription of some blood pressure medicine. Here, literally, you're going to pay maybe $40, $50 for the same prescription.
Okay, but we don't have any of that.
Yeah.
So we don't know. All we know is that is what some people
they tell us is very affordable.
Yeah. So in the meantime, we stay healthy, we eat well, and we get our exercise. And we think, well, I think the less stress of living here in Mexico helps us to live longer.
I think so.
Yeah. So
fresh food every day.
Every day. And we also eat out at restaurants. So we have another channel if you want to see about that. But this one is all about retiring here in Mexico. We hope you've enjoyed this video. Again, if you have questions or comments, please leave them down below.
Please leave them down below. Try to answer them for you.
And we'll talk to you next time. Hasta luego.
Bye.
Ciao.